Can you listen me, madam?
No, ma'am, can you hear me?
Reena, madam?
Yes, Vivek, we
No.
can hear you. Good morning.
Yes, that's great. So I am happy to tell you that today we are conducting this fantastic program, and I wish to share you that our office head is Honorable Commissioner Sir Rajiv Nivatkar Sir. He is having some very important meeting with the Mantralaya. That's why he will be coming after some time. In the meanwhile, uh, I'm very happy to share you that today one of the grand personality in the field of dentistry, Dr. Mahendra Mahajan is here, and he came all the way from Nashik. Uh, why I told you that he is a grand personality because he is, as per my understanding, he is the only dentist from Maharashtra who scaled Mount Everest, and he is having many feathers with that. He has two Guinness record on his one walking from I think Manali to Leh. I had been to Leh and it is very different out of the thinking. Then he and his brother, both of them crossed USA, one famous cycle rally is there, and in record time, for which they have been praised by our honorable Prime Minister also. So and our joint director, Dr. Kananwala sir, is very much here. He himself an orthopedician, eminent orthopedician, and he was in a very prestigious two institution, J Medical College of Mumbai, Grand Medical College Hospital of Mumbai, and BJ Medical College Pune. So I welcome you, sir, on behalf of this uh, food delivery program. Why we are celebrating this program today? Because this is the day of birth anniversary of first Indian solo athlete who won the medal in Olympics.
I think there is some network issue there, probably.
I think their connection is getting disconnected.
Yeah, it's a little shaky connectivity. Sometimes inside offices, it's like that.
Sorry for the किती लोक जायचे नाही लोक ऑनलाईन
Really very cold today. You're on mute. You're on mute, Puneet.
I said a lot of flights and trains are getting cancelled.
Yeah, I went and changed
Because
the
of the
coat.
fog.
I was feeling so cold. And in NCR now we have that gap again. So the cars are again stranded. I mean, I don't have a
Yeah.
BS6. So that's again another issue. Vishnu.
So again, we'll continue this program. So I was telling about Dr. Chandamale sir. He is the joint director here and orthopedician, PhD in orthopedics. So I welcome you, sir. With this. Along with us, the Dean of Government Dental College, a very prestigious institution in India, Dr. Bird Madam is there. I welcome you, Madam.
Thank you, Professor. Thank you.
About Dr. Mahendra himself is here. So we are having separate program for his felicitation.
Yes, thank you, sir.
Then Dr. Tabitha, Madam.
कॅमेरा बघ कसा लावलाय
Dr. Suryakant Pawar, newly professor, become professor of orthopedcia. Sir, he is a professor now.
Yes, very good.
And Dr. Abrar.
Thank you, sir.
Dr. Atul. So I request Dr. Chandanaraja sir to have few words with us.
Yeah. Good afternoon to everyone. Honorable Dr. Puneet Ahuja, Dr. Atul Surve, Dr. Reena Kumar, Dr. our Joint Director, Dr. Pakmode sir, Dr. Bhatt madam, and all the colleagues from the dental department, along with, of course, Dr. Hitendra Mahajan and Dr. Mahendra Mahajan. Today we are celebrating the State Sports Day on the birth anniversary of Khashaba Jadhav, who was a wrestler, and in I think years back he had won the Olympic gold medal. Today we are seeing that so many India is getting gold medals because of advancement, good nourishment to all the sports players. But when Khashaba was there, really it was a tough time. Our 150, 200 people, the sportsmen used to go, and we were getting no medal at all. But Khashaba has shown, he had shown that in those days that he had won the Olympic. It was really great on proud of the Maharashtra state. So Maharashtra state decided to celebrate the birth anniversary of Khashaba Jadhav as a state sports day. So I am really proud and I am really thankful to dental department that they are arranging such type of functions. And on this event, we have called Dr. Mahendra Mahajan, he's a MDS from JDC Nagpur, and Dr. Hitendra Mahajan, he's UG PG from BJGMC Pune. Now, regarding these both the Mahajan brothers, they are basically from I think Khandesh, and they have basically they have won the race across America, which is the world's toughest bicycle race, which was, and this event was praised by Honorable Prime Minister in his Man Ki Baat. Both the brothers, they were the team members of 6,000 meter cycling. That was a golden quadrilateral challenge relay in 10 days and 19 hours. Along with that, they have been awarded by state government of Maharashtra by Sri Chhatrapati Krida Puraskar. And along with that, Dr. Mahendra Mahajan, which is practice, he has done the 2 Guinness records. One Guinness record that he had a cycling from Kashmir to Kanyakumari, as well as the fastest journey from Leh to Manali by foot. So I really appreciate both the Mahajan brothers that on the event of this birth anniversary of sports, the Khashaba Jadhav, the state sports day, and I really thankful to Dr. Pakmode sir and Dr. Bhatt madam calling me here to start this event. Our commissioner sir is busy with Mantralaya event, so he'll be back once more. Till that time, I just hand over this mic to Dr. Pakmode sir. Thank you very much.
Thanks a lot, respected sir. So good beginning is there because we are happy that orthopedics is one of the prominent department to deal with the sport injuries. So thank you so much, sir. And now the further proceeding, we have decided to continue with the lectures. And later on, as soon as our honorable commissioners are come back, we will felicitate Dr. Mahendra Mahajan, which will be a very proud moment for all of us, and his brother online, Dr. Hitendra. Thank you so much. Over to Dr. Atul.
Thank you, sir. Very warm good afternoon to everyone, and we welcome you all for this wonderful program for the sports dentistry on the day of Maharashtra State Sports Day. For this today's series of the lecture, we have esteemed speakers. Our first speaker is Dr. Puneet Ahuja. Sir is a BDS and MDS in oral and maxillofacial pathology from Government Dental College and Hospital, Nagpur, Maharashtra. Over the 32 years of active teaching, administrative and corporate dentistry and experience, Sir is the ex-president of IDA Noida branch for the consequently of 2 years. Sir is the president of Indian Association of Oral and Maxillofacial Pathologists, invited as a speaker and panelist at various international and national conferences, workshops and symposia. The area of interest of the sir is oral pre-cancer and cancer, mucocutaneous lesion, bone pathology, forensic odontology, faculty and development program, dental practice management, communication and soft skill, and sports dentistry. Sir is currently working as a principal and professor at Babu Banarasi Das Dental College, Dental Sciences College, BBD University, Lucknow. We welcome you, sir, for this today's program, and everyone will love to hear you from this oral awareness of the athletes. Over to
Thank
you,
you.
sir.
Thank you, Dr. Atul. At the outset, I would like to thank the Directorate of Medical Education and Research, Mumbai, Maharashtra, the directors, joint directors, especially Dr. Vivek, for organizing this program, one of its kind, and inviting me as a faculty to speak on this. My co-speaker for today, Dr. Reena, Dr. Mrs. Bhad, who was my senior in Government Dental College, Nagpur. Good morning, ma'am. I'm very proud of the Mahajan brothers, Mahinder and Hitender. Mahinder is junior to me and is also a maxillofacial pathologist. All the viewers who have joined into this program, a very good morning, warm welcome. Can I share my screen now, Dr. Atul?
Yes, sir, please.
Okay. Uh, I think, one second. I think you have to close your screen. Is somebody else sharing a screen?
No, nobody's sharing. You can share,
sir.
Puneet, because I think it's available for you.
It's one second.
Sir, you have the host right, sir. Can you please share your screen?
Yeah, it's no, my screen is not showing on this. One second.
You want to drop off and join again, Puneet? Maybe it might sort it out.
Because my PowerPoint screen is there right now, but is it visible to you?
No, are you getting the share screen button? Are you getting the share screen on the right, on
Yes,
the lowest
I'm
one?
I'm getting that button.
Should I just share mine to see whether it's only the problem with you or it's problem with me also? Should I share it and just
Yes,
see?
yes, yes, please. Yeah, please.
Okay, I'm sharing, huh? Let's see. That's coming. So you have the share screen. It's coming.
Because see, once I click on the share screen, I get these three options: Chrome tab, window, and entire screen.
On the entire screen, click your PowerPoint, sir. It will
Yeah,
come at
do the entire screen.
Okay, entire screen, and
Choose the PowerPoint.
Put your PowerPoint from there. On the file
okay.
folder, open your PowerPoint. It will be visible to you.
Is it visible now?
No.
Because here now I have made it full screen on my laptop.
on your laptop, are you able to see your PowerPoint?
Sorry?
PowerPoint.
No, no, I can't hear you, Dr. Atul.
Sir, can you
Your
please click
laptop,
on the
are you
share?
able to see your PowerPoint?
Puneet sir, can you please see your phone?
One sec. Yeah, hello. Yeah.
Now that we are just a few of us here, Vasu, hi, great to see you. It's really wonderful to see you. Hi, Dr. Mahajan. It's really nice. I said, this is fantastic for me to have you around.
त्याला फक्त एक click करा green. चालू झालं. Now she can hear you.
Good afternoon, Reena. Welcome to the program.
Hi, Vasu. Thank you so much, Vasu. Having you here is great. Having
thank
friends around and seeing, it's really lovely date and lovely thing to happen.
Thank you.
Ma'am, sir is joining in next 1 minute.
He's rejoining again, Atul, Dr.
Yeah.
Puneet.
Facing some connectivity issue or maybe
Can't
some.
hear.
He's facing some connectivity issue and a technical glitch. So he's just dropped out. He's coming in the next 60 seconds.
You are very far away from the mic. It's very weak, very, very weak.
Okay, can you hear me now?
It gets a little better, but the audio is very feeble from the office.
Okay.
Like you really have to strain the ears here. Dr. Mahajan, what is that emblem you're wearing on your chest?
That is Shiv Chhatrapati Awardee.
Oh, lovely, lovely. It's wonderful. Congratulations, wonderful.
Thank you. That is the highest sports award by government of Maharashtra.
Yes, yes, I know that. I know that. It's
And,
fantastic. I just want to know what was that emblem.
Okay.
Great. Really, really make the profession proud. We're so happy.
Thank you, madam. Thank you.
Reena, when are you coming to Mumbai?
Unmute ke.
When are you coming to Mumbai?
Well, Vasu, I just live hop and skip away from you now. I live in Goa most of the time. It's just that currently I'm sitting in Delhi. It's a little bit of work to be done. But otherwise, I live in Goa. So I'm hop, skip, and jump. So I should ask you, when will you come to Goa?
You invite me, I'll surely come. But you come to Mumbai.
Yes, yes, I will. The head office beckons. Head office beckons quite frequently. I will see you.
Drop into Mumbai and come to GDC. You just let me know, okay?
Puneet, I'm letting him in. Welcome back, Puneet.
Browser is not allowing to join, to share the screen. And somehow my Zoom app is not opening this thing.
But Puneet, you are co-host. I think you should be able to join. You should be able to share screen.
No,
Suppose
because I have
co-host
joined
wants
through
to.
my browser. Hello. I'll do that. I'll do that. Yeah.
Is it coming on WhatsApp or is it coming on email?
Puneet sir, can you please share it to Rina madam?
I can't hear.
Dr. Reena, I have just emailed it to you. Yeah, it's
Which email? Which email ID?
your Gmail ID, which I had.
Okay. Okay. It's
One
yet to
second.
come in. I haven't received
Yeah,
it
yeah,
yet.
it is adding the attachment because it's a bigger file.
Yeah. Okay. I'll wait for it to come in.
It's still adding the attachments.
Okay.
Yeah, it's sending it now.
Mhm. As soon as I receive it, I'll just give you a
Yeah,
thumbs
yeah,
up on that.
yeah. Now message has been sent. You can just refresh and check it once.
Yeah, I've refreshed. It's not coming yet. Not yet.
This is the one I have sent it on your ID.
Dr. Reena 1296 at gmail.com,
Hello.
right?
Hello. Sonia, मेरा lecture है
It's at Dr. Reena 1296 at DRREENA1296 at gmail.com. Is that the
Yeah,
one?
yeah, yeah. Correct. Yeah, yeah. I've
It
sent it
hasn't
on
come
that.
yet.
Yeah.
I haven't got it yet. Maybe the file is too heavy. Is it fast? Just see if it's gone. What is
No, no,
the?
it's gone. It's gone. Yeah, I can see it in the sent folder.
Not received yet.
It's not that. It's about 10 MB, so it's not that big a file. Also,
Can you resend it and also to reena@igacia.co? I'll just send it send it to both the email IDs.
one second.
I'll put it on the chat.
Reena at the rate.
IGESIA.
Okay, I guess here dot.
.co.
That's it. Dot co.
Yeah.
Yeah. Okay.
Resend to both, please. Oh, I got it. Puneet, I got it. Don't worry, I got it.
Okay. Okay. Okay.
It's come. Just download it. Yeah, okay, Puneet. Whenever you're ready to go, I'm ready to share.
Yeah, yeah. Please, yeah. You can. I'll just keep telling you to change the slide if you don't mind.
Of course, I'll be happy to do it for you.
Yeah.
Happy to do it.
Thank you so much. Very sorry for
Not
the
at all.
delay.
I'm very happy to help. Not at all.
Technology also, fails us sometimes.
Not at all.
All
It's
right.
Murphy's Law.
Good morning, everyone. Sports and oral dental health, which is a part of sports dentistry, is a wide field which is gaining recognition across the world and is an established branch of dentistry with specialized dentists working as a team along with the coach, the performance, the physiotherapist, the medical doctor of the team or the individual who is participating in any kind of sports event. Next slide, please. Okay, so when we see the components of sports dentistry, it is very vast. Uh, when I was working in corporate dentistry, uh, I had dealt with some of the sports persons and athletes in New Delhi. And when I went through the textbooks and literature, I found that the scope of sports dentistry is massive. If we start with, it deals with dental trauma of the adult and the pediatric sports persons or athletes, then the restoration of teeth which are damaged by trauma, dealing with endodontic problems, tooth wear in athletes, prevention of sporting in dental injuries, the role of nutrition in sport, and the current sports nutrition advice because the sports nutrition keeps changing very fast. Then oral health of the elite athlete and the performance. Screening for dental diseases among elite athletes to prevent the dental problems and disorders and delivering dental facilities at sporting events. Next slide, please. So, coming to the role of sports dentistry, it is a relatively modern specialty within dental education where the role of general dental practitioner is dealing with the specific dental challenges modern day sports present us with. So, from dealing with dental trauma, sports dentistry has involved into significance of the role of the dentist within the medical team. And how can the dentist support medical colleagues? They introduce preventive measures in the sporting context, the role of oral health with elite athletes, and the importance of screening for common dental diseases. Sportsperson and athletes are a particular set of patients which have more demanding dental demands than our regular patients. The primary objectives of sports dentistry are the below mentioned four to inform dental and medical practitioners how to deal with trauma in the head and neck area, both on the field and outside the field within the dental clinic. Second is to introduce the concept of dental screening, particularly during pre-season assessment. That means when the athlete or the sports person is not actively participating in competitive sport, that is the time when a dental screening should be done for the athletes or the sports persons to see if there is any particular dental disease or disorder which can be prevented or which can be treated before the competition starts. The third is to prevent dental trauma of acute and chronic type, acute being direct trauma to the hard and soft tissues, and chronic being a tooth surface loss as a result of erosion. Now, as we go ahead with the presentation, we will see in brief that what are the different types of dental disorders that the athlete or the sports person can get. Mind you, friends, I will not be talking about how to manage the trauma or the dental diseases because that is more or less on the same lines as the treatment that we do for our regular trauma patients. So, management or treatment of the disorders or the trauma is not part of my presentation today. Okay, coming to the fourth objective of sports dentistry to study the role of nutrition in elite and amateur athletes with a view to reducing the need for them to require reparative restorative dentistry in the long term. Next slide, please. Okay, so let us understand what makes up an athlete. You are looking at the screen where you have environmental factors, psychological factors, and then the physiological factors. These three factors together will influence that whether the sports person or the athlete can become a top level or elite athlete. Also depends on the type of the sport or the athletic event that the person is participating in. Let's take, for example, Dr. Mahinder Mahajan and Dr. Hitendra Mahajan, who are long distance cyclists and long distance, they do walks for long distance. So they will come in the category of endurance sports. Whereas there are some sports like a 100-meter sprint, which are explosive in nature, which require a sudden burst of energy but for a very short period of time. And the third is where the strength of the athlete or the sports person is required, which are mostly the weightlifting and the throwing events. So, depending on the type of athlete, of course, the body type, that is the morphotype, also determines whether a person can become an elite athlete in that particular field, and also the type of dental disorders or dental diseases which the athletes or the sports persons will face also depends on the type of sports that they are participating in. Next slide, please. Can I have the next slide, please, Dr. In? Thank you. Okay, so let's see the risk factors affecting the oral health of athletes. Number one, hypocylia or hyposalivation or alteration in the salivary flow. Very common. Eating habits. Because of the intensive training and the dietary controls, the eating habits of athletes are generally disturbed, and they also partake of lot of energy drinks and energy powders, protein powders, which are very high in carbohydrates, proteins, and acids. And these proteins and acids cause a heavy burden on not only the teeth but also on the kidneys and the liver. Third is the traumatology, or the kind of traumatic injuries which can occur to the athletes. Fourth, the psychology, or the psychosocial elements involving the athlete, where there is stress just before a competition, which may lead to eating disorders or some other things such as bruxism. Fifth is medication. All of us know that athletes at the top level do indulge in doping, anti-inflammatories, and sometimes self-medication, which may be harmful for not only the general health but also the oral health. Next, the training frequency and intensity of the athlete may lead to immunodeficiency or immunomodulation, which may lead to oral diseases. Education, knowledge, and motivation for oral health in athletes is something which is lacking, I'm sure, in India. So that is where the role of preventive measurement is measures are required for the elite athletes and sports persons. And the last is the accessibility of dental care, whether it is on the field or off the field, and prioritizing regularity of the checkups to prevent further dental diseases. Next slide, please. Okay, so looking at the energy requirements of athletes and the consumption and expenditure, we know that they consume high levels of sugars and carbohydrates along with the proteins. These may lead to disorders such as tooth
देतो का
erosion and dental caries. Next
आमच्या
slide.
आमच्या बरोबरचा एक
Uh, Intensive workouts,
सुमितला
trainings,
कोलॅप्स झाला
and during the sport,
त्या ग्रुपमधला जो
uh,
जो
the,
2 महिने सोबत
the
होता
saliva production gets altered,
एक
which
ठाण्याची मॅडम
leads
होती
to
ती पण त्याच
and
गोष्टी
to produce that homeostasis, there is buccal respiration, less salivation, increased chances of dental caries because of dry mouth syndrome. Ulcers and burning of the mouth may occur because of the dry mouth. The athletes or sports persons may have a metallic taste in the mouth, and it may also lead to reduced
गेटवेवरनं त्यांनी
immunity and
सायकलिंग हॅव
lubrication.
डन इट इन अ युनिक वे
Next
म्हणजे
slide, please.
इथून सायकलिंग
This
करत
is the
आपण
mechanism of protection for saliva
आणि
in our mouth, and any
सी
alteration
टू
in
स्मॅश
the production
दिस वॉज द
or the
फर्स्ट टाइम
composition
सम
of the
इंडियन हॅज
saliva
डन दिस
will somehow lead to either dental erosion
जेव्हा मी
or
जेव्हा मी
a
रिलेमध्ये
reduction
सायकलिंग
in
करत
the
गेलो होतो
uh, uh,
सी इट वॉज नॉट अ म्हणजे
facility
आता
of
तू
the
10 ला
absorption
पूर्वी
of
चालवायचो
the
मी 10 वर
nutrients,
चालवून 10
or
गेला
even the
फर्स्ट डेला
swallowing
मी
or
धुवायला
other
बसतो
food habits of the athlete. Next slide, please. Dry mouth in dry mouth syndrome in athletes, which may be caused because of hypersalivation, uh, leads to bad breath, hoarseness of the throat and voice, irritation and burning sensation on the tongue and mouth, dental caries, gum diseases, teeth erosions, and may also lead to production of opportunistic bacterial and fungal infections like candidiasis. Further, it may also lead to difficulty in speaking and chewing. Next slide, please. These are some of the things that can happen in dry mouth syndrome: periodontal diseases, cervical caries, mucosal consequences such as Candida albicans or other bacterial infections, opportunistic infections which can occur. Okay, leading high cumulative and high intensity trainings may lead to immunomodulation or immunosuppression sometimes in the athlete, and this will lead to alteration of the immune system, which is directly linked between the intensity of training and the reduced immunity, and this has high chances of fungal and bacterial infection, and it may cause long term risk factors and compromises the general health of the athlete also. Next slide, please. Okay, the psychological factors in athletes, especially just before a competition. We know that the elite athletes or the top level sports persons are under a lot of stress even during the training period when they are not competing, but especially just before a high level competition, the following things can happen. The pupils get dilated, the saliva flow is inhibited, there is acceleration of the heartbeat, the bronchi dilate, there is a inhibition of secretions in the body, there is conversion of glycogen to glucose, peristalsis gets inhibited, and the bladder gets contracted. All these are to prepare. Just a moment. Can I have the last slide, please, Dr. Reena? Can I have the previous? Yeah, thank you. All these are basically preparing the body to respond to the needs of that competition where the athlete or the sports person is participating. Okay, next slide. Now, the psychological factors may lead to grinding of teeth or bruxism in some of the athletes or sports persons. And as dentists, we all know the consequences of bruxism. It leads to wearing away of surfaces, dental sensitivity, loss of occlusal surfaces, tooth mobility, gingivitis, gingival recession. In the orofacial or craniofacial area, it leads to facial myalgia, headaches, TMJ disorders, subluxation, earaches, and maybe limited mouth opening. And when we talk about the systemic consequences of bruxism, the athlete may have interrupted sleep patterns, there may be neck ache or backache, there may be posture alterations and biomechanical alterations. Next slide, please. These are some of the pictures of bruxism. There is loss of the vertical height, occlusal and incisal surfaces get worn away. The masseter muscle gets hypertrophic because of constant grinding of the teeth. Next slide, please. And also, the psychological factors in athletes are not only due to the participation in the competition or the kind of burden or the kind of demands that the sport has, but also because of their own body image in the athletes. The perfect body, which is associated with beauty and performance, is all often unrealistic. And there, if they don't have, then it may lead to low esteem, and which may be a dangerous combination, which leads sometimes to eating disorders such as anorexia nervosa and bulimia in sports persons. And such kind of eating disorders can again lead to dental erosions, tooth sensitivity, dry mouth, caries, gingival diseases, TMJ disorders, and oral infections. Next slide, please. And the eating disorders, because there is regurgitation of food, there may be vomiting of the food in the athletes, which may lead to wearing away or erosion of the tooth surfaces. It may lead to mucosal infections. It may lead to enlargement of the submandibular gland and other soft tissue lesions. Next slide. Okay, coming to the dental injuries or trauma in sports, there are a lot of risk factors involved in each and every kind of sport. Of course, there are the risk factors are more in certain sports, such as contact sports, like boxing or say ice hockey, or Dr. Mahinder and Hitendra do cycling. I'm sure they understand the consequences of the injuries faced, and especially head and neck injuries faced by cyclists if they fall off from the cycle. Can I have the next slide, please? Yeah, next slide. So there are various types of injuries in adult athletes as well as in children during sports. And if you see the lower left side of your screen, you will find there is a small picture of our cricketer Anil Kumble, who very bravely went on to bowl and play the match even after having a mandibular fracture. He suffered a mandibular fracture. He was there was wiring done. He was taped, and then he continued playing the match. So, of course, the facilities for dental intervention for sports injuries is an essential part of the sports team. Next slide, please. And for types of contact sports or even other sports for that matter, one of the most helpful thing is a mouth guard. The mouth guards are designed to absorb and distribute the forces of impact which are received while participating in athletic activities. Next slide, please. On the left, you have a picture of a stock mouth guard, which is commercially available, which is common for the upper and lower teeth together. Now, most of these sports, the sports persons or the athletes have customized individual mouth guards made for them, and it is different. It is a separate mouth guard for the maxillary teeth and separate for the mandibular teeth. Next slide, please. Okay, these are the ones on the left side. You can see these are the custom made guards for the sports person, and this is how it should look. And these are the areas which it should cover. If you can see, it is specially cut to accommodate the frenum and the other attachments of the buccal mucosa, completely covering the teeth and the gingiva right up to the sulcus. On the occlusal surface, it is perfectly matching the occlusal surfaces of the teeth and extending just up to the palate. On the other picture, you can see a helmet which a child is wearing for cycling, and also that the helmets which are a protective mechanism are different for different sports. We all have seen that since many years in cricket also, our cricketers are wearing specialized helmets which are made for cricket only. And then of course you have helmets for sports like rugby, for sports like ice hockey, and the goalkeepers in our field hockey also wear helmets. So these are customized helmets which are a protective mechanism to prevent head and neck injuries. Next slide, please. So in conclusion, what I would like to tell all the viewers is that the role of the dentist in the whole team of a sports person or athlete is that he or she has to very closely work with the other doctors or the other persons in the medical team of that athlete. Now, if you see this picture here, the dental practitioner will be dealing with the podiatrist for occlusion, posture, and distribution of forces. He will be dealing with the sports doctor for medications, doping, infections, and traumatology, with the coach for educating and prioritizing the oral health of the athletes, then with the psychologist for understanding the stress, the stressors, and the tensions associated with the sport and preventing bruxism, occlusion, and stress, and other eating and eating disorders and dental erosion. He will also be dealing with the physiotherapist for buccal respiration, with the osteopath for posture and articulations, and of course with the dietitian, which is an essential part of the sports person's practice regime, is how does the diet affect the caries and other dental diseases in the particular sports person. So all these together have to work in harmony if we have to provide a efficient level of sports dentistry to our athletes and sports person. Next slide, please. Thank you, everyone. You have my number and my email ID. And in conclusion, I would like to mention again that sports dentistry, if you see the literature and the textbooks which are available, it's very vast. In India, it is still at a very fledgling stage, but I would like to congratulate and thank Dr. Vivek and Dr. Reena that they are taking the sports dentistry and the awareness about dental health and oral health in sports persons to the next level. I hope we are all going to participate in this actively, and soon it becomes part of our curriculum to teach the budding dentists as well as the practitioners. Thank you so much.
Atul, you're on mute.
Atul, you have to unmute yourself.
Oh, apologies for the glitch. Ma'am, can you hear me?
Yes.
Yes, Dr. Atul, we can
Okay,
hear you now.
great. Thank you. Thank you, Dr. Puneet. I'm sure this is a pretty enlightening session from your end to all the viewers and the participants, those who are watching this program. And
Thank you.
we all are aware about the kind of injuries that are happening in the sports arena. and all these things which are coming up into the sports industry. Meanwhile, all the time there was all the medical fraternity who was going to take care, but now we as a dental fraternity, we are going to look after all these kind of injuries are happening for the athlete. So for which, how we can go ahead, what is the roadmap, what is the kind of dentist can do it, and what are the kind of strategies that what we are having right now in India. So for this, we have the next speaker, very esteemed speaker, Dr. Reena Kumar ma'am, who is going to talk about the capacity building about this sports dentistry in India. Meanwhile, going further, I would like to introduce the ma'am. Ma'am is the orthodontics and sports dentist since 2012. The contribution from the ma'am to the sports dentistry is the ma'am is the Asia Pacific clinical director for the Special Olympic Bharat. Ma'am has contributed for the sports oral health advisor for the Special Olympic Asia Pacific, sports dentist for the World Summer Games Los Angeles in USA in 2015, World Winter Games in Austria in 2017, World Summer Games in 2019 in Abu Dhabi. So yeah, that's since last 3 years she has been participated as the sports dentist for the Special Olympic as well. Conducted 6 orientation training program in sports dentistry, sensitized over 750 dental professionals to the sports dentistry, speaker in the sports dentistry for more than 15 national conferences. Ma'am has also received Gasunino Health Leadership Award from the Special Olympic Asia Pacific for the providing oral health support as a sports dentist to over 1.5 million special athletes of Special Olympic Bharat. Along with that, the Leadership Excellence Educational Award from American Academy of Developmental Medicine and Dentistry for disseminating the education on management of oral health needs of special athletes. We are very delighted and honored to invite you, ma'am, for this program, and we are really awaiting to listen from you that where are we standing in this sports industry, and is this the correct time, or maybe what will be the future of the sports dentistry? Please guide us for the same. Dice is all over to you, ma'am. Thank you so much.
Thank you so much, Atul. Thank you very much. And thank you, Dr. Puneet, for that wonderful presentation and setting the stage for everything that to go ahead. Because I see that Dr. Pakmode is not here, but I would really like to extend my gratitude and my thanks, big time thanks to him, to Dr. Vivek Pakmode, the Joint Director, Dental Education and Research, Dental Medical Education Research. And of course, the entire team. We're very thankful for the time or the thought, which at least even I understand, we all appreciate and understand the busy schedule of the Commissioner, Shri Rajiv Nivarthan, but the very fact that he's been, willing to come and be with us at whatever time he can, I think we all fold our hands and say thank you to him. Dr. Dilip Mahishekar and Dr. Ajit Chandanwala, and of course, my very dear friend, Dr. Vasundhara Bhatt. And I can't say anything more about Dr. Mahajan Brothers. Thank you so much that you have added so much glamour and so much, let's say, spirit to our profession through your accomplishments and your all that you have done in sports, which adds value to us and adds validity to us as sports dentists. Thank you so much for that. Atul, may I share my screen?
Yes, ma'am, please.
Thank you so much. Thank you. So you see, today is one fantastic day because this gentleman, it's last year that I saw the first time that the Google Doodle was put up, where Dada Saheb Jadhav was felicitated by Google, recognized by Google on his 97th birthday. So it's very interesting to know the few things about him. Pocket Dynamo. Is that a simple name? It's a fantastic name, Pocket Dynamo. So he was a power by himself. So when you look at his story, it goes on to say that this gentleman had his father as his coach. And I know somebody sitting right here amongst us, Atul, who has his father as his coach. And that's something which is really fantastic. So, the gentleman over here, Dada Saheb Jadhav, what happened with him is that he was trained by his father in the village and then grew on, and finally, with some international help, went on to give us the first individual gold medal in the 1952 Helsinki Olympics men's freestyle bantamweight category. We honored him, and today we are honoring him again, but we honored him way back in 2010, when the Delhi Commonwealth Games was named, the wrestling stadium was named after him, the Arjun Winner Award. I would like to call all our attention on this particular one because what I read about him, I kind of Googled a little and I did read about him. So what comes out that the community support which came out. So why am I stressing on this? I'm stressing on this because unless the whole community comes forward and really works with our athletes, whether it is a community of dental surgeons, medical professionals, all stakeholders, the community at large, they have to come forward and support the sports person. So now this gentleman's journey to Helsinki was made possible. Look at the names which are involved here. The Maharaja of Patiala, he provided a break for him to qualify for it. His principal of the college, Raja Ram College, I'm sure the college still exists, mortgaged his house for his student for 7,000 rupees, just to ensure that Dada Saheb Jadhav could make it to Helsinki. Now look at the commitment of his village, of his town, of his city. The shopkeepers of Karad and his friends arranged for his kit. So everybody pulled in. Everybody pulled in, and this man made it to where he is. And today we sit here and we stand proud on his shoulders as a nation, So the community support and all of us together is something which is an inherent thing which we have learned now when the minute you look into his life a little more. And of course, terribly honored and taken completely by kudos that our Chief Minister from Maharashtra, Shri Eknath Shinde, and of course our Sports and Youth Minister, Dr. Shri Sanjay Bhansode, declared that this is not going to be a one-time event. This is going to be an every year event. And that is congratulations to Maharashtra, congratulations to everybody in our country that, we are taking this gentleman's legacy forward and in such a big way to inspire everybody. Thank you so much, Directorate of Medical Education and Research, especially our, very close friend and associate, Dr. Vivek Patmode, for making this happen and making it 15th as a great day by us from dental surgeons also to celebrate this event. So today I bring to you that the need for the hour, with Puneet, Dr. Puneet Ahuja just gave us an extensive presentation on which he kind of gave us a total insight on what really the athlete is going through. There is so much happening within him. Yeah, it's happening to everybody. But the question is the athlete getting that attention in time? Why is it important for him? It's important for everybody, of course, but why is it especially important for him? Especially he talked of elite athletes. You see, these guys are training for 7-8 years and things like that. And then on that last day, he doesn't make it because he has a toothache. He doesn't make it because he has a trauma. He doesn't, or he's taking the wrong drugs inadvertently given by his doctor, his dentist, and he loses and he's in penalty for the doping. So I want to really talk about what is it that the role that we all as a dental community, as a fraternity have to play as a capacity building for establishing sports dentistry in India. Sports dentistry is there. We all know, as Puneet very rightly said, he went through the books, and he saw a lot over there and it is there, but it is not the same. It is very different because we really, really need to know how different the needs of a sports person is. Like if there's a trauma, the sports person cannot be said, okay, you sit and wait for 2 weeks. He has to be brought back to play as soon as possible. His come back to play, return to play has to be fast. Doesn't affect the team, doesn't affect the medal tally, doesn't affect his psychological breakdown, doesn't affect the whole community as a large and everybody who's supporting him, because there's a lot of other things behind which I will talk about today, which happens in sports. So the giant leap, of course, started the minute this new education policy came in, and we said sports is something we are going to build from the ground level. So the national school education, the new education policy said every school has a, you have your classroom, you have all of that, but you have to have a playground. You have to have a PT teacher. You have to have certain school sports that every child is taking part in. So the culture of sports in India is growing. The school sports, the national talent, the Khelo games which came forward, the Khelo India games, the university games which has come forward, all of it together. And of course, the 12 verticals. Look at the 12 verticals which are there over here. What do you see over here missing? So what do you see? Playfield, coaching, Khelo India, state level, annual sports, talent search, utilization, women's sports, fitness, physical fitness, all right? Support, promotion of sports, promotion of rural and indigenous sports and peace. Where's health? Where's health? Where's dental health? Where's oral health? Where is all that which is essential for every sports person to be absolutely fit? So when we look at the sports industry per se, you'd see this is kind of divided into, you would see professional sports, sporting goods, sports retailing, fitness training. It's a big time program now. Sports tourism, amateur and recreation sports, and sports medicine. All of this is all there. And the worldwide sports market is now valued at this much billion dollars. So you see, $620 billion is the market value of the sports industry. So there is something which is going on over there, and which is definitely that we have to think about. So when I studied and went through stuff to learn, where do we stand in the market? Like, tomorrow, if I really want to take sports dentistry into the market, we'll want to know, does it have some value? Am I going to spend my time uselessly? Am I going to spend my energy uselessly on something which really there are no takers for it? So the market size of the sports industry across India in 2022 was 142. But look at the CAGR, which is projected from 2020 to 27 is 15.59%. So the annual growth rate. So the growth rate is huge. It's not in single digits, it's in double digits. It says 15.59%. And the projected value is, the volume of this is entire going to be of that much. So it's a huge market which is there in India itself. This is. So again, when you look at the sports industry and the consumer market, because there's this huge demand, and the COVID really made us aware that whether you have money, whatever you have or not, health is the one thing that one needs to invest in. And one of the ways to health is fitness, is sports. So the consumer demand has really propelled sports to become a huge industry in the world, global industry. So sports sponsorship market. Now, why are people going to put in money anywhere if there is nothing called return? So if I am a sponsor of something, if I am a corporate, if I want to really sponsor something, I must have a get back in it. So there's huge sponsorship market on. And if this market is growing at the CAGR of 6.36, surely there is much more happening there, which we are not really looking at. Look at the Indian sports sponsorship market. Of course, maybe it is limited to certain sports. Now, of course, in the last few years, I would think that we have grown to a lot of other sports like kabaddi and things like that have also come in. But the sponsorship market grew by 14% in 2017. And with the demand, the CAGR is 6.36 again, and it keeps growing, you see. The industry is huge, and you can see which are these sports which are actually taking this in there. Big market here. The growth prediction is huge. When we look at the Indian market, and every sports person, now whether even if it's a child going to play in the school sports, they will have a jersey, they will have a shorts, they will have trunks, they will have something or the other which is there for them. So and plus there is sports equipment which happens. So sports apparel, sports equipment, look at the market. Look where we stand here in the revenue generation. India is number 3, only behind China and United States. So we have a huge sports equipment market right within our country, which is on there. When we look at the sports apparel market, the CAGR is 16.2% because the demand is so high, because everybody wants to be dressed right. So if you want to be dressed right, carrying the right equipment, there is much more now that we need to kind of build into this dress right and be right and be ready for sports kind of a thing. Look at the global technology, because today you can sit in your living room and you have a television and you can see the ball being hit from whichever level, whether it is at coming from the eagle view or coming from the ground view, coming from underneath, coming at a 60 degree, coming at whatever degree. So technology, not just there. And we just heard Puneet speak about diet. So along with diet is also exercise, and also about how do you actually triage an athlete. How do you triage an athlete, whether this athlete can actually take up the endurance sports. It's not just on the BMI, it's also the various technology which is there, and how you can train the athlete by doing the various test regimes, and also seeing how his lactic acid production and how his muscles are actually taking care of it, how the relief from all that fatigue is happening. So there's a lot of technology behind. And today medical when you talk of the sports medicine, Sports medicine is a booming industry again. We will look at that. So the global technology market is growing at 16.95 prediction. So huge number, there's a growth in here. Sports supplement. Again, Puneet spoke about, the sports persons are always taking all kinds of supplements, whether in the form of protein supplements, carb supplements, depending on what kind of nutrition they need to burn. If they need to burn something which is, rapid fire, then they will probably take a huge burst of carbs. And if they are going to go on a endurance, then probably a different kind. So that's what are they going to burn? Now, the sports supplement market, again, is at 6.6%. It's a huge market size. It's a huge market size, big market. And look at the 19, 20, 30, we are looking at 19.8 billion is what we are looking at. Every one of us are in some way or the other suffering this. The sports nutrition market, which is a huge market, 8.2%. Major part of Puneet's presentation was on the, on the nutrition part of it. Sports drinks, because they all feel that they need to kind of imbibe something inside them, especially which could be giving some quick burst of energy at some level or the other. So 4.8% is the CAGR. So with all of this, if we kind of, Puneet did define, my previous speaker, Puneet did define sports dentistry, gave the objectives of sports dentistry. But I would like to take it from the American Academy of Sports Dentistry as, if it says that we are looking at a branch of medicine which deals with prevention and treatment of dental injuries and related oral diseases associated with sports and exercise, right? So what should our commitment be? Our commitment should be to the overall healthcare of athletes, support the athlete to achieve the full potential. Our knowledge should be such that we know what this athlete is doing, what we should do, or what we should not do. That is very important. How can we support this athlete by giving the right medication, being conscious of gender sensitization, being conscious of, our prescription sensitivity and all of that. Of course, looking at how do we sensitize the athlete, how do we, prevent various things and give the best dental care possible. Sports medicine. So if we are a part of sports medicine, as ASD says, as most textbooks would say, then let's look at the sports medicine market. So what's really happening there? The sports medicine market has grown, exceeded 5 billion in 2021, projected to grow over 6.8% CAGR between 22 and 28. Now, why is it happening? Because we cannot treat the athlete the same way that we would treat any other patient. We have to treat the athlete with a return to play and as non-invasive as possible. So growing technological advancement, especially with regenerative medicine, minimally invasive surgeries, this is the role, which has taken sports medicine, really propelled it forward and making it into something which has a huge market share. So now if we say that, all right, sorry, I will go back there once more time, because if the sports medicine in India is meant to grow like this, what about us? What about us is the question. So when we talk to people, as I said, we all want to know, you want to go and buy a car, you will say, okay, it costs so much, fine. I've got to spend this kind of money. I have to take this kind of a loan. So how much mileage will it give me? How many years can I run it? What is it about? What is the rate of the fuel, which is going to be? All kinds of questions will come up. What is the, service? Kitna mujhe service mein mangta hai? That is what they ask. And how much will it demand? How often do I have to get it serviced? What is the maintenance of it? So similarly, every young dental surgeon or every senior dental surgeon, I think, will ask this question. I'm doing fine. I'm doing fine. I'm okay in my practice. Or the youngster says, well, is this a risk I'm taking? What is in it for me? So sports dentistry, is there a difference or is it the same thing? I've graduated after 4 and 5 years in college. Do I really have to, can I not just open up my clinic and just start being a sports dentist? These questions come to my mind. What happens if, is this going to be some new scope available for me? Is there some success? Is it going to make me stand out as one person in the community of already, saturated dental surgeons in my community where I live and where I'm going to practice? I don't know where I'm going to find a place where I'm going to be the one dental surgeon or the two dental surgeons, but there are plenty, my left, right, everywhere the dental surgeons. Is it going to change my career? Is it going to make any kind of a, increase in my income? Because at the end of the day, it is how your money bank is ringing is what is important. So when it comes to these questions, I will ask only one thing, that where am I positioned? In which domain am I working? I am working in the healthcare domain. If I am working in the healthcare domain, anything new that I'm going to put in or learn or invest my time and money and energy in, is it going to add value? Is it going to add value? So the value is it a health system value? Yes, it is. Sports dentistry is a health system value. Is it a population health value? Yes, sports dentistry will make it into a population health value. Does it change the environment and the economic value? Obviously it does, because I just showed you some records of all of that. So if all of this is true, that it is going to add value, then yes, sports dentistry is something that we need to reckon about. So here I look at, is sports dentistry really there? Is there any data about it? Of course, there's nothing in the Indian market which is there. We don't have it. And when I looked at this, I saw the US data, and it's essentially focused only on the mouth guards. Nothing else. As though as sports dentists, we have no other role, no other earnings, no other income generation except for mouth guards. So how little we are projected in the market, not just the Indian market, which is of course very meager, but the international market also is very limited projection, I would say. While when we look at India, when we are looking at I'm just taking the last year's, you could say, the 4th Asian Para Games, and look at the medal tally. Look at the wonderful medal tally that we had in the Para Games, this time in the Asian Para Games. If this is what is happening in the medal tally, and the demand for this, the sporting, fitness, the recognition, this is at the World Games at Berlin. So this was our tally at the World Games, 202 medals by special athletes. And of course, our Asian Games. The Asian Games has brought us great glory. India's historic Asian Games campaign. If this is the situation, that we have so much of interest in sports, there are people who will say, I've heard Dr. Pakmode say that I never sleep without watching one sporting event itself. There are people who say this, every day, no day is complete without me going to the sports field for something or the other. I need to be there. Everybody is into sports, whether it is into, recreational sports, whether it's into competitive sports or into elite sports. So if it is, all of this is there, and there is a huge demand for it, where there's a market growth for it. So sports dentistry is something that we need to reckon with. Now you look at these pictures we saw in the recent past, very recent past. We've seen these, of course, these huge collisions where, your own team member actually hits out and, hits their own goalkeeper, and what really goes on there. And this time we saw at the FIFA, we saw all these protective masks coming out only after they are injured. Friends, only after they are injured. What does it mean? It means there's a coach which is saying, oh, this gentleman is going to now have a little trouble. This athlete is going to have trouble actually coming back to the field because he's never worn this stuff. And then his team members are going to have difficulty kind of adjusting suddenly to see their member playing like this, one of their own co-players, athletes playing like this with all of this. So the question comes, does it have to happen only when there is an injury? Or do we not think of it as these are guards that we would like to have before, so that there's no injury? So we need to not just treat injuries, we need to make sure that we are in the business of preventing injuries. Prevention is better than cure. Awareness is better than, the patient coming or the athlete coming, walking into our clinics and just saying, I don't know what it is. At Indian Dental Association, I'm a proud member. I stand tall and proud as an IDA member. And as the voice of the profession, we have always tried to stay ahead, all of us at the IDA, and we pledge, because India is out to be a big multi-sporting country, emerging out as a huge country with the support of the Prime Minister, the Chief Ministers, and every state. Look where we are today. We are there today only because the Chief Minister supports something. The Youth and Sports Minister supports something. So there is the stakeholder, especially the trickle is not from below up. The trickle is from top to down. And the trickle is really fast because it is moving, and it is a multi-sporting country. So IDA pledges healthy and safe sports. So for this, very, very delighted and proud to announce that we had set up the Indian Academy of Sports Dentistry a few years ago. And the sports dental centers are the two momentum which we have taken on from the IDA to ensure that we are very much, as dental surgeons, very much in the race, and such that we make our own place in the community and in the society, especially as a part of sports medicine team. So no sports medicine, we saw Puneet's presentation where he put up Anil Kumble, Mr. Anil Kumble's picture with that bandage around his face. If you go into the history, I met Mr. Anil Kumble personally. It was a physiotherapist. He was playing somewhere in the West Indies and he had a physiotherapist. There was no dental surgeon. He had to wait to come back to India. Yes, he was a very brave man. He played with all of that pain and everything else for the nation, for the country, for his glory, for his team and for himself. But he had to come back to India, meet one of our dental surgeons, Dr. Krishnamurthy and Dr. Krishna Naik, Dr. Kishore Naik, and have his treatment done by us. And yet today, when the very same people are, holding leadership positions with various athletic and sporting teams, do not think that it is required that they must have a dental surgeon on their team. So what does this speak for us? It speaks for us that we need to be heard. We need to have a voice. We need to be able to, garner a team of people. We need to have capacity. We need to build that. So this is where IDA has come in, and Indian Academy of Sports Dentistry and Sports Dental Centers. What is the objective of having this? The objective is basically to bridge the gap. Now, somewhere along, you see, even a senior person like Dr. Puneet and me, we would all admit, all of us would actually admit that probably many years ago, we really did not know what is it sports dentistry is all about. Is it just about dentistry for another person who just plays sports? Or is there more specialized thing which happens there? So between the curriculum of the DCI given to us, it is a very chock-a-block filled curriculum. It doesn't really have space to have modules there in the clinic, in the DCI probably. But what stops us from actually bridging the gap? Coach for all stakeholders, create all levels of courses, starting, catering and meeting to the needs of who is the person attending. Let's scale up our dental clinics and let's make them into sports dental centers. And the need for Center for Sports Dental Research is so important because the R&D there is so critical. Mouth guards are not, okay, we have custom mouth guards, yes, but will the mouth guard be the same for a power lifter? And will the mouth guard be the same for a hockey player? No, it'll be different. Obviously, it'll be different. So how do we know that? Will it be different for a person who has body type is different? Will it be different for a person who's a bantamweight? Or for, these are the things that we need to. Helmets. Helmets is something Dr. Vivek is always talking about. So, how is it that the helmet design, should it be just made for one for all? It's a cookbook design. Okay, here's a helmet, go buy it. So we have to do research. And then India is again a country which is, let's say, resource crunched in many ways. We don't have a technology base very strong that way, but we need to have motivation and maybe use material like cork. Cork is again some materials which have actually got an ability to take impact, to absorb the impact. So how we can use a lot of indigenous material, a lot of, let's say, less expensive and less cost-intensive material, and make it, maybe labor is enough for us, maybe labor intensive and maybe labor less intensive, but look at how we can create new R&D research especially, such that we can support the athlete in what his goals have to be achieved and how we are going to help them. So we would say these are the mission, of course, which has been said rightly by Dr. Puneet, my previous speaker, has very well put it. But here I would like to add, what I would like to add is we need to build capacity. We need to create awareness. We need to have advocacy. We need to have educational training. But most importantly, we need to be visible. The athlete does not know where to go. The coach does not know where to take the athlete. The leadership right there doesn't know who is the sports dentist? Where have I seen one? Have I seen a board anywhere? So we need to be visible. We need to be in reach. We need to be easy to access. So this is where I say that capacity building is the most important thing that we really need to look at now. We all know, yes, it's there, but is there a market? We have shown that it's a market. Now, is there a niche available? Yes, because this is a minimally offered service. This service is not offered by every person, because everybody cannot be a sports dentist. Everybody can be aware, but to be sports dentist, you need to go that one scale above. You need to train, you need to upskill, you need to train you need to move your clinic to become a sports dental center. And this is still a service in our country, minimally offered. So there is a huge niche. There's an area for lateral growth for mid-level practitioners, senior level practitioners who are kind of bored doing their endodontics and orthodontics like me. Yes. So we would need to kind of move into newer areas which offer us excitement and allow us to be where we want to be on the sports field in our dental clinics simultaneously. And for the younger people who are always worried, oh my God, on my left, on my right, in my front and my rear, there's always a new dental clinic. So here is your chance. Make your clinic a niche area. Build your practice through sports dentistry. That's what I say. This is a very important part. We have so many athletes, and our athletes are training in different areas. But how many athletes are actually making it somewhere? At the Asian Games selection, the minute the news went out that the dope control officers were coming, there was only one athlete standing there. There was only one athlete standing there. The rest had all vanished from our sports field. So as a result, this is the Hall of Shame. Now, what is happening here? They are not aware what is it going to hit them, and we are not aware. Now, we as dental surgeons, suppose I do give a medicine, suppose I do prescribe something which is actually going to show up somewhere along, or maybe an alcohol-based mouthwash itself, something like that, which is going to show up and going to spoil that athlete's career. Do we know what the penalties are? This athlete is trained for 7 years, 8 years, and then goes into the Olympics. And then he is caught right there by the dope control officer. First offense, 4 years. Second offense, 8 years. And he himself is a broken person, is a completely broken person. So don't we come into this area at also? So prescription sensitivity, a very, very important part for us dental surgeons to know, that I should be knowing actually, is every person who's coming in, not just looking at where do you work and what do you do and what's your problem. Are you a sporting person? What level of sports do you play? Is your coach along there with you? Are you going to be taking part in any competitive sports in the recent past? Have you taken in the recent coming time? Have you taken part in anything? So our sensitivity to prescription writing, we have to be empowered dental surgeons, sports dentists. That is when you become a sports dentist. You can't write anything to anybody. You can't just say, okay, I will treat that person just like anybody else is going to be treated. No, I have to make sure this person goes back to play, return to play as fast. I make sure that I give him the correct medication. I am going to be very, very clear about this. So at the Indian Academy of Sports Dentistry, which I have the honor to say that I'm the academic director of that. So what we thought is this should be our roadmap. We started out well in 2019. 2018, we established. 2019, we had the first fellowship program. And we had about 18 to 19 students who graduated in person. About 5 or 6 of them were hybrid. So we hadn't really learned the hybrid really well. So our first step is to sensitize dental students and oral health needs of sports persons. So the roadmap ahead is, unless we catch them young, that the budding youth has to know, the young dentist has to know that what is it that there is something called sports dentistry, and that the health needs of the athletes are plenty. There is a huge market here. They're sitting here. I've just shown you all the data on the market-based research, which I've just shown you. Then we have the plan that orientation course in sports dentistry, which is open to everybody, to every person who is a student or otherwise. Fellowship courses in sports dentistry, and create sports dental centers, with the idea that we need to increase the market share of dentistry. Care providers and expanding the sports industry in India, very, very important for us. Create employment opportunities. As I just showed you, that this is still a service which is minimally provided. Sports dentistry is not a service which is provided by anybody and everybody. The athlete does not know, the coach does not know, the leadership does not know where to take these athletes. So this is a niche area which can help provide that. And of course, we can, make team dentists, because it is such a matter of pride that I am a team dentist to a team, which may be even just a competitive team. It could be to a school, it could be to, elite sports, that be a team dentist. Apply and, kind of take yourself ahead, go one beyond. So at the Academy of Sports Dentistry, we are basically looking to sensitize and educate dental surgeons, teachers, students, coaches, policymakers, all stakeholders. Professional courses and orientation, advanced and fellowship courses. Very important for us is the sports dental centers and team dentists to be sports-focused care, on-field emergency, pre-play exam, as it was pre-season examination, which is very, very important, so that the entire session and the entire season where the athlete is going to be in competitive sports or in playing, he is going to be trouble-free, or he knows how to maintain his oral health, which is the path to general health. Maintain dental records with sports and our research and development. Today, we are with the dental education and medical education and research team, and we thank you again, sir, for all this opportunity that you have created. And I believe that as sports dentists, that we need to have a research and development, which is very, very important, because we need to get into material research, protective gears, performance enhancement, laboratories, all with clean sports in mind. Obviously, clean and fair play is the base of everything of all of this, which is there. So at the fellowship in sports dentistry is, as I said, we started out in 2018-19. And at that point of time, the program was mostly in person. And we'd obviously, because of the COVID coming in, we could not run that program subsequently, but now the program has started again. And this program is now, we have learned that it is a better way is that we go hybrid. So that way our reach is far more. We are going to have people who may still want to invest in sports dentistry in their time, but may not be able to leave their cities because of, let's say family relationships, their care for their parents, time, travel, logistics, finances, all of that. So this is now a 12-month program, which is focused. It's a modular. The delivery is online and hybrid. It has live classes. So all the classes will be live, though we are going to be having an LMS there. We have an LMS, but the material is all kept there. But however, every class is a live class and it's on a dedicated LMS. Best in faculty, of course, that is going to be there. Assignments, which is going to be formative and online, and summative assessments. Term projects, two months of project, attractive scholarships, and of course, we're looking at other affiliations which are going to come in through that. So I will like to say that, let's elevate your presence. Let's elevate, let us look at ourselves that, I'm not going to sit where I am there and say, I'm santusht. No, I'm not santusht. I want to do more. I want to be there. I want to really act. So now be a team dentist. Go ahead. Meet the school right near your house. Meet the sports club near your house. Tell them who you are. First, recreational, competitive, elite, it doesn't matter who. If you like research, then get into be a researcher. Look at how you can do nutrition research, oral health research, because we have a lot of data now coming out, mostly epidemiological data. Even then, we don't really know how many cyclists in India. So I'm taking cyclists because we have cyclists and marathon runners here. How many cyclists in India have what kind of diseases? We have an age group of so-and-so. We have Karnataka athletes. We have, South Indian athletes, but we do not know sports-wise, because the delivery of sports dentistry has to be sports-wise, athlete-wise, the need-wise, the sports, it has to be that. Psychological aspects, what is really happening in there? Because we all know after COVID that the mental health, how we cannot keep it locked in the closet. And the mental health and the psychological status of an athlete, whether it is because of injury, whether it is because, bulimia was touched upon, because let's say in India, I would like to use the word athlete triad, female athlete triad, where the female athlete is often under so much pressure because he's being trained by the male athlete under the standards and guidelines of the male athletes. Male coach, or a coach who's actually training the male athletes and doesn't know that the body type of a female athlete is different. So the female athlete is now going through a whole lot of cringing and psychological issues, or the athlete is not able to go back, or there is bullying, whatever there is so much on psychological aspects to be done. Gender, studies on gender research, dope control is another great area where you can actually come forward and be a dope control officer. pledge that you would be there. Revamp your clinic, expand and extend your services. We need to do that. You know, trauma prevention, I will always say trauma prevention first, not management later on. WADA, NADA sensitive. Just be very sensitive about what we are going to prescribe to our athlete, what it can do to the athlete's life henceforth. Yes, Atul? Provide nutrition guidelines, tobacco cessation.
Can you hear me?
So today at the Indian Academy of Sports Dentistry, of which I am honored to be the academic director, the Indian Dental Association, we dedicate today in the honor of, the ultimate gentleman who's been there, who's made us so proud, on whose shoulders all of us stand, because we got our first individual medal, Kasaba Dada Saheb Jadhav. We dedicate the sports dental centers we are looking at that. All our sports dental centers are dedicated on this day to him today from the Indian Academy of Sports Dentistry. So I would say that all of us should build our brand, be a sports dentist, look at how we can adopt new technologies and new learnings, build the future of sports, changing the attitudes to oral health, both of the professionals as well as our athletes. Grow your presence in society and look at holistic care for athletes. Let's build capacity, upskilling through education, and align our practice to the growing consumer demand and sports health industry. So knowing is not enough. Knowing that sports dentistry exists, knowing that athletes are there, knowing that they have trouble, but we must apply. Willing is not enough. We must do. This is what the great person, Mr. Bruce Lee, said. And I would like to close by my closing statement that dentistry must be cognizant of the growing consumer demands and adapt to the market calling. We need to grow up. We need to grow. We need to meet. So from the Indian Academy of Sports Dentistry and Sports Dental Center and all of us today, first thing is I thank you all for having me here today and congratulate the DMRF again for this wonderful, momentous day that we are celebrating, the Maharashtra Sports Day. I'd like to invite you to join the Indian Academy of Sports Dentistry, the Fellowship in Sports Dentistry. Lead the change. Come and lead the change. Make your clinic into a sports dental center, and of course, be a team dentist. Thank you very much for your very kind hearing. And I'm very grateful and honored to be here today. Thank you, sir.
Thanks a lot.
Thank you, Atul.
Madam, I'm really happy that for this function, as we have decided earlier, our commissioner sir has joined. He is Sri Rajiv Nivatkar sir. He is a very versatile personality and having extensive experience in administration. He was collector of Mumbai also, and he worked at different parts of Maharashtra, and very much learned person and having in-depth knowledge of many different fields. So I am really happy that sir is with us. On behalf of this day, as you know, today is the Khashabad Ado. I will put a photograph here. Because this is the first year we are celebrating this day, because Khashabad Ado was the first Olympian from India who won the solo Olympic medal in 1952 Helsinki Olympic. And as you know, this year Paris Olympic is there, and India is going to win around 50 to 100 medals, and all the credit goes to the initiative taken by Khashabad Ado. So to commemorate his achievement, Maharashtra government had decided to have different day, the sport day. And to commemorate this occasion, under the leadership of our commissioner sir, we have decided to have this day, and we have rightly invited Dr. Mahendra Mahajan. He is personally here, and his brother Hitendra Mahajan, who will be online, because they have bring a great glory to our profession. Both of them have scaled Mount Everest in 2019, and both of them have crossed a wonderful race, very difficult race across America, 6,000 kilometers, and for which in record time, and for which they have been invited by our Honorable Prime Minister. At the same time, he mentioned about it in his Mann Ki Baat. At the same time, Dr. Mahendra Mahajan is having many other laurels, including Guinness record. So, first of all, on behalf of all of you, I welcome our Commissioner, sir, with a book and a book, flower.
Thank you.
Thank you so much, sir. I request Commissioner, sir, to have few words, and then we'll felicitate Dr. Mahendra.
First of all, I am very much thankful to Joint Director Pakmode and Joint Director Dr. Chandanwale to arrange such a combination on this auspicious day, having the State Sports Day along with the sports, they have academy, dental academy lectures. So there is an initiative to go ahead in certain aspects of our medical education. In fact, I also welcome Dr. Mahendra Mahajan and Dr. Puneet Ahuja and Dr. Rina Kumar for joining this our day for the lecture. They have got some time, so they were able to spare the time for us. One more thing I wanted to add is, a few days back I was discussing with Joint Director Dr. Chandanwale that we should have a good dental unit in our GMCs. But we can have one more thing added to this, that the sports dentistry can be a part of that. So let us have a dental college in our GMCs. GDC we will have, but in GMCs also, so that we have a huge span of our institutes across the state. So we can have two things in that. One is for the geriatric dentistry and one is for the sports dentistry. So I just read the presentation Dr. Rina Kumar was presenting. There was you have just mentioned there that the schools, colleges, and other sportsmen in that area also can be covered in that. So we can offer some help to them also. And I am very much privileged to have with us Dr. Mahendra Mahajan, and I think Dr. Hitendra is also joining online. It's okay, but they are with us, so yeah, very, very nice to see Dr. Hitendra. So it is a
Thank
good
you, sir.
occasion. Yes, good occasion that such a gigantic sportsmen are with us, and they have encouraged us till our depth of our life. So I am happy that they are joining here, and I am just going to meet them with some. What has you brought? Acha, okay. So Dr. Chandramale, we can go ahead in this regard. Sport dentistry and the geriatric both. So we can have good unity in our GMC. Please come.
Thank you. Thank you very much. Yes.
This is a book, I think, chosen by Dr. Pakmode. So he is quite choosy in the books. Yeah, no,
Yes, sir, you orthopedician,
Thank you very much, sir.
Wish you the best.
Thank you,
And
sir.
we will seek your help whenever required.
Surely, sir.
Yeah, yes.
Sir, as Dr. Hitendra sir is traveling, I request Commissioner sir and Joint Director sir to felicitate Mahendra Mahajan again.
On his
On
behalf.
behalf of Dr. Hitendra sir, please be online.
That is really great. I am very fortunate and thankful to be a part of this event. I'm thankful to Commissioner sir and all other dignitaries, and I could also hear nice talk about sports dentistry. There is really a lot of things we can do on behalf of as a doctor towards the sports community, and I'm Am I audible? Yeah, thank you, Mahendra, for receiving on behalf of me.
You're audible. You're audible.
Yeah, yeah, and good to see Chandanwale sir, with whom I could work and learn a lot during my tenure. Massacre sir, I could interact with during Nasik MUHS. So we are really overwhelmed, sir, and we are thankful. Both Mahajan brothers, we are thankful for this felicitation. Thank you very much, sir.
Yeah, yeah. See, the interactions always boost some imagination and new ideas. So that is very much required to interact with each other. So this has just, when I sat here, it gave me an idea that we can also go into that. Huh? So we will start.
Dr. Atul is very enthusiastic. He himself is a great player, sir. Atul is a karate player, having a lot of laurels to his credit.
Yes. We had been
and
with.
a very enthusiastic person.
डॉक्टर
नाही नाही नको मला नको
तुमचा करूया ना पुस्तक तर देऊ I also felicitate Dr. Joint Director Dr. Pakode for arranging such a nice program. And I invite Dr. Reena Kumar and Dr. Puneet Ahuja to visit our office at some point of time so that we can discuss many issues in this regard.
Thank you, sir. Thank
Sure.
you so much, sir.
Thank you, sir.
Thank you, sir.
Thank you.
I request Dr. Mahendra Mahajan for few words of importance. Please.
Yes, sir. We brothers are really thankful, sir. Nivatkar sir, Chandanwale sir, and Dr. Pakmode to take that initiative because I think this is for the first time that Maharashtra state has declared, and it's declared this day as a state sports day. And being a dentist, and I'm a practicing dentist at Nasik since 20 years. And we brothers have tried to balance our profession and our passion. My brother Hitendra is anesthesiologist. He's heading the department at Ashoka Medicover, a corporate hospital. And we try, the basic idea was to stay fit because COVID has taught us, and it is very important for everybody to stay fit. And we both brothers have pledged that every day, at least for 1 hour, we should spend for ourselves, for our health. Now, many people, many a times we have been invited to give talks. That what point I insist to is, what is happening is we are now addicted to mobile. Everybody. So I tell people to sleep an hour early and wake up 1 hour early, and that 1 hour you should engage in some sports activity, which is going to make your life easy, not for yourself, for your, even you can take care of your family, and that 1 hour is very important for us. Now, talking about what my personal experiences in sports dentistry, we both brothers were about to summit Mount Everest, and there was this Chinese mountaineer who had a dental abscess. And he was taking some Metrogel 8 tablets in a go, some haywire. Then I corrected the dose, and he could not, like, Everest, you have prepared so much, you have spent so much, your 1.5 months you are there at the base camp in the very harsh environment, and he could not go for the summit. Now Everest summit is done in a particular period, like that 4 or 5 days are very crucial, and if you miss that bus, your entire year is wasted in that. But somehow then he got over the abscess and he could go later. Okay. And there are, of course, in my clinic I have there was a national competition of boxing which was happening, and I was able to deliver them the soft guards, which I had a suction machine and we could deliver those bite guards, and I could be of some help. But definitely even I would like to get involved into sport dentistry and enhance my skills through IDA. And that's a really great honor. And the sports for everybody is, you are able to cope up. The things have become stressful. Even the dental practice is quite stressful. So what it offers, like many a time it is asked, like many a time I'm been asked, how does this help you? So there are two ways which I see it. One is I am more agile, and I'm more, I can concentrate on my work. I can deliver the best. It is a great, any sports is a great stress buster for us. That is very important in today's world. And it also like monetarily aspect people ask like how it helps. So I get connected to my cycling friends, I get connected to my runner friends, the mountaineering friends, and they turn out, they become my patients. And every patient appreciates your outdoor involvement or your sports involvement. So that is very important, I see. And once again, I thank you, Nivadkar sir, Chandanwale sir, and our Pakmode sir for having both our brothers here and felicitating us. Thank you very much. Thank you, sir.
Okay.
Thanks a lot, Dr. Mahendra. तुम्हाला बोलायचं की
Dr. Chandrawale. Yes. You can sum up if you want. Okay.
So today, I think it is a wonderful day because this is the beginning of a new year and very auspicious day. Two good things, great things are there. Makar Sankranta, we are entering in some other phase of the year. At the same time, this is the first time Maharashtra government is celebrating Krida Divas, and we are really honored that Dr. Mahendra Mahajan, all the way he came from Nashik, and he was postgraduate student when I was in Nagpur. I used to observe him. At that time, I was not aware of his activity, and I am very enthusiastic sports person myself. I represented my school, college in cricket and kabaddi also, two different contrast sport. But I am not a very luminous sports person, but I am having tremendous interest in sport. Every day I watch match. Without watching any football match or cricket match, I cannot have my day full. So because of that, I took an initiative to take a lead in sport, and we have formed a group of a sport dentist group across the India. And I'm happy to share with you, sir, this is a WhatsApp group around having 105 members. Mahendra is the 100th member, and out of which around 80 to 85 members are principals of different colleges, dental colleges in India, and they themselves enroll themselves. They send us request and then we have enrolled. So they are also very enthusiastic, and we are going to take this movement ahead with your guidance, sir. Every month we are going to have a lecture. Next month we have planned lectures on, as you rightly said, on the geriatric dentistry. And then next month we are having a lecture on artificial intelligence in cosmetic dentistry. So likewise, under your guidance, every month we will have two invited lectures. In this way, throughout the years, we will go ahead. Under the leadership of our sir, last year we had a fantastic year of oral health mission, Swachh Mukha Abhiyan, and one of the gigantic sport personality in the world, not only India, in the world, that is Sachin Tendulkar sir, Bharat Ratna Tendulkar sir, is our brand ambassador for 5 years. So a great person is attached with our movement. So thank you everyone. Special thanks to our commissioner sir, Joint Director Chandan sir, Atul sir, then Mane sir, Duri sir. He is Dr. Ramgude sir. He is also one of the very special person. He is LLM sir. He is building MDS and LLM and pursuing a PhD also in law, no? PhD? PhD in law. So, and of course, Dr. Mahendra, and online Dr. Hitendra. Thanks a lot, sir. Thank you so much.
Thank you. Thank
Thanks
you
to
very
Rina
much.
madam and Punit. Thanks a lot, sir.
Thank you very much. It's been an honor.
Thank you,
so
everyone.
much.
Thank you.